Professor William Copeland led a groundbreaking study that challenges conventional wisdom about childhood resilience and its impact on long-term well-being. Copeland is a professor of psychiatry. Thank you for joining us.
Glad to be here.
Thank you. So your study suggests that children who show resiliency overcoming mental health challenges don't necessarily prove to be more stable as adults. How'd you come to that conclusion?
Yeah, well, this is kind of a unique study. This is one of the first studies where we've been able to look at childhood resilience measured with multiple interviews when the kids were kind of growing up. And now we've followed up the children into adulthood and been able to look at their mental health functioning and also their functioning in important life areas. And what was surprising to us is these kids who were doing well in childhood, they'd been exposed to multiple traumas, but they'd continued to function well despite that, were now struggling as adults. They had higher levels of anxiety and depressive disorders.
We're embarking on a time when a whole generation of youth faced a big mental health challenge, and I'm talking about the pandemic. So what for those kids as they move into adulthood, you think?
Well, I think one of the conclusions people draw is that kids that are doing okay now are resilient, and they're going to continue to be resilient over time. And what our studies suggest is maybe not. That just because they're resilient now doesn't mean that they're not going to experience negative effects of maybe COVID, maybe some other early adverse experience later on. Sometimes the effects of these adversities can be delayed, but our study suggests that they can't be avoided.
How should parents react to your findings?
Well, I think that what I take away from it is that my goal when it comes to working with kids and working in my community is to find ways to reduce the likelihood that kids are going to be exposed to early childhood adversities or trauma. Things like peer victimization, maltreatment, financial hardships. We need to find solutions to these types of challenges instead of just trying to encourage folks to be resilient after they've already faced these challenges.
William Copeland, thank you very much. Be well.
Thank you.